Hello everyone. As I mentioned last week, I will provide you with weekly updates on our response to the COVID-19 pandemic and current hot topics. I hope these updates will help everyone understand what is being done and why, and will address any rumors or misinformation that is occurring outside or inside the agency. First, non-COVID related, let me say a few words about the devastating tornadoes that happened last Sunday and early Monday morning. The tornadoes that touched down on Sunday impacted many areas around Yazoo County, Mississippi. Fortunately, FCC Yazoo City did not sustain any damage, and reports indicate that staff property damage is minimal. A much different story unfolded in Estill, South Carolina, as the area was hit by a tornado early Monday morning. The institution suffered significant damage, and as with any type of emergency situation, the Bureau quickly assessed how to best ensure the safety of staff, inmates, and the public. As a result, because of the extensive damage to the facility and the infrastructure, we made the decision to begin relocating the inmates. Please keep our staff in the affected communities in your thoughts and prayers, as they also begin the daunting task of cleaning up in the aftermath of these storms and rebuilding while still dealing with the impact of the COVID-19 global pandemic. More than 40 of our institutions nationwide, approximately 1/3, have now been directly affected by COVID-19. Nearly 450 inmates currently have confirmed positive lab for COVID, but we're also starting to see an increase in the number of cases resolved. Sadly, there have been 15 COVID-19 related inmate deaths. We must continue to be supportive of our 200+ staff members that tested positive and be thankful for the increasing numbers that have recovered. Unfortunately, Danbury, Butner, Lompoc, Oakdale, Elkton, Milan, Forest City, and Yazoo City all remain hotspots for COVID-19. They continue to need every bit of support that we can provide them. Secondary law enforcement officers located throughout our agency are being deployed to assist with staffing shortages in these locations and others as the pandemic continues. We're still working hard, using all of the authorities granted to us to increase our use of home confinement. We continue to aggressively screen all inmates who have COVID-19 risk factors, starting with the inmates incarcerated at our hardest hit facilities. Since Attorney General Barr authorized us to prioritize home confinement in response to the COVID-19 pandemic, a mere 2.5 weeks ago, the BOP has placed over 1,119 inmates on home confinement, an amazing undertaking under the best of circumstances, and these are far from the best. As we continue to battle this invisible enemy, we have begun Phase 6 of our Coronavirus Action Plan, as we shared earlier this week. It is an extension of the measures outlined in prior guidance, along with new measures to continue managing the evolving pandemic. As part of Phase 6, the Bureau will continue its nationwide action to minimize movement, continue medical screening, and maximize social distancing in order to decrease the spread of the virus. Social, volunteer, and legal visits will also continue to be suspended. These actions will remain in place until May 18, 2020, at which time the actions will be reevaluated. Wardens have been reminded that access to legal counsel remains a paramount requirement and must be accommodated to the maximum extent practical. Although legal visits are currently suspended, federal courts continue operating at reduced levels, and therefore, case-by-case accommodations should be made at the local level, and we are working to increase access to legal counsel through the use of video conferencing. A new measure in managing the pandemic for institutions with active COVID-19 transmission, especially Care Level 3 and 4 institutions, includes satellite feeding all inmates in their units. Meals, eating utensils, and drinkware should only be served by staff wearing proper PPE. When meals are being distributed, a distance of 6 feet between inmates must be maintained. Staffing remains a priority for the Bureau, especially during times such as these when all of our resources are being utilized. Hiring initiatives are paramount in addressing our shortages in key positions and locations. We must continue to place an emphasis on prioritizing the hiring of correctional officers and medical personnel. Wardens have been asked to ensure human resource departments are fully engaged in processing new applicants into the agency. And as a reminder, all applicants who enter the institution will undergo the same COVID-19 screening and temperature checks as staff, contractors, and visitors. The Bureau continues to coordinate with the U.S. Marshals to significantly decrease incoming movement. Strategic institutions have been identified for mandatory movement needs. These locations will include all detention centers and other facilities strategically located throughout the country to accommodate population increases. These areas will serve as quarantine sites until such time when inmates can be moved to their final destination. As discussed in Phase 5, 7 strategic sites have been identified to house incoming inmate movement from the United States Marshal Service. These sites will serve as quarantine facilities throughout the remainder of the pandemic. At all institutions, compartmentalization of staff and inmate movement will continue to help slow the cross-contamination of workspaces and housing units. This restriction includes limiting supervisor and manager movements for rounds to specific locations. I am asking everyone to use good judgment and common sense. If you do not have an absolute need to move between areas, buildings, institutions, etc., while on duty, please do not. It is vital that we limit the potential for cross-contamination as much as possible. During the COVID-19 response period, staff post assignments shall not be changed unless for the purpose of filling a vacant post. Changes in shift hours are permitted, provided the shift location remains the same. Good hand and health hygiene practices as universal precautions must be carried out. These practices include washing hands regularly with soap and water for at least 20 seconds, covering a cough or a sneeze, avoiding touching the face or shaking hands, limiting contact with high-touch surfaces, and staying home when sick. Social distancing should be practiced whenever possible, and face coverings must be used to prevent disease spread. Strategies for accomplishing social distancing should continue to be evaluated, especially in open bay and barrack-style living quarters. Regular cleaning and disinfection of units and high-touch areas should continue to be emphasized to the inmate population, as well as a practice of good hand and health hygiene. Wardens must ensure cleaning supplies are readily available. It is essential that all institutions continue to review and update their pandemic plans to include identifying locations for quarantine and isolation of potentially large numbers of inmates, purchasing appropriate supplies, and planning for potentially severe staffing shortages or moderate to severe disruptions of normal operations. All institutions should continue to discuss strategies and develop plans with local health authorities and community health resources to prepare for both limited and widespread institution transmission for COVID-19. Please continue to do your very best to stay healthy. Your dedication to keeping yourself safe, along with your fellow staff, inmates, families, and the general public, continues to highlight what a corrections professional is all about. You are the ones making the difference by carrying out our mission in spite of the unique challenges we are experiencing during this unprecedented public emergency. You are the ones coming to the aid of your colleagues in need following the devastating storms. You are what makes this agency great. I couldn't be prouder serving our country with you. I thank you and your families for the sacrifices you are making to accomplish our mission. We will get through this together because we respect, trust, and care for one another. One agency, fearless, strong, and making the difference.